maximizing EHR reporting for quality improvement and data analysis, real-time data access and analytics, data dashboards. EHRs often feature customizable dashboards that present real-time data on clinical operations, patient outcomes, and key performance indicators, KPIs. These dashboards allow administrators and providers to quickly assess performance, identify trends, and make data-driven decisions. Clinical outcomes. Tracking. EHRs enable the tracking of clinical outcomes over time, such as the progress of chronic disease management, treatment adherence, or patient satisfaction. Providers can use this data to identify areas of improvement and monitor the effectiveness of interventions. Quality improvement, QI. Initiatives, automated reporting. EHRs can automate the creation of reports for quality improvement initiatives, such as those required for accreditation, regulatory compliance, or reimbursement. These reports can be generated based on real-time clinical data, saving time and improving the accuracy of reporting. Benchmarking. Many EHR systems allow practices to compare their performance with industry benchmarks or peer groups. This helps practices identify areas where they are excelling and areas that may require further attention or improvement. Population health management, data segmentation and analysis. EHRs can segment patient populations based on specific characteristics, e.g., age, diagnosis, risk factors, and provide insights into the health needs of different groups. Providers can use this information to tailor care plans and implement proactive interventions for high-risk populations. Predictive analytics. Some advanced EHR systems include predictive analytics tools that use historical data to forecast patient outcomes, helping providers anticipate complications or identify patients who may require additional resources. Clinical research and evidence collection. Data for research. EHR systems can generate anonymized datasets for use in clinical research, enabling healthcare organizations to participate in studies and contribute to evidence-based practices. This allows for continuous improvement in treatment methods, patient care protocols, and clinical outcomes. Clinical trial recruitment. EHRs can assist in identifying patients who may be eligible for clinical trials by analyzing their medical history, condition, and demographics. This streamlines the recruitment process and ensures that patients have access to cutting-edge treatments. Challenges in EHR adoption and best practices. The adoption of electronic health records, EHRs, has the potential to revolutionize healthcare delivery by improving efficiency, patient safety, and clinical decision-making. However, the transition from paper-based records to EHR systems presents numerous challenges for healthcare providers and organizations. Addressing these challenges effectively is crucial to ensuring that EHR systems deliver on their promises. Overcoming resistance to EHRs, addressing provider and staff concerns, resistance to change, provider reluctance. Many healthcare providers are accustomed to their traditional workflows and may view EHRs as a disruption to their routine. Some clinicians fear that EHRs will increase their workload, reduce face-to-face interactions with patients, or diminish the quality of patient care. Staff resistance. Non-clinical staff may resist using EHR systems due to unfamiliarity or perceived difficulty in learning new technology. Resistance is often stronger when staff feel that the EHR system will impact their productivity or efficiency. Best practices. Engage providers. Early. Involve healthcare providers in the EHR selection and implementation process. By ensuring that they have a voice in the decision-making process and understanding their needs, you can promote buy-in from clinicians. Highlight benefits. Clearly communicate the benefits of EHRs, such as improved patient safety, more efficient workflows, and enhanced data accessibility. Emphasize that EHRs can reduce the burden of paperwork and enhance the clinician's ability to deliver quality care. Provide emotional support. Acknowledge that transitioning to EHRs is a significant change and can be overwhelming. Offer emotional support and encourage open communication about concerns. Concerns over workflow. Disruptions, workflow interference. Providers may worry that EHRs will disrupt their established clinical workflows and take time away from patient care, particularly during the initial implementation phase. Best practices. Tailor EHR systems to workflow. Work with the EHR vendor to ensure that the system is configured to align with the practice's specific workflow. Customize templates and order sets to reduce unnecessary steps. Gradual transition. Implement EHR systems in phases, allowing clinicians and staff to gradually adapt to the new system. Start with less complex areas, such as patient registration or scheduling, before expanding to full clinical documentation. Managing technical issues and system downtime. System downtime. Unplanned downtime. EHR systems are vulnerable to technical issues such as server failures, software bugs, or network outages. System downtime can disrupt patient care, delay documentation, and hinder communication between providers. Best practices. Backup systems. Implement a robust backup system that ensures data is securely stored off-site in case of technical issues. This allows for quick restoration of patient records and minimizes disruption to operations. Downtime protocols. Develop and regularly update downtime protocols that provide clear guidance on what to do if the EHR system goes down. Train staff on manual workarounds, such as paper-based documentation or using backup systems to maintain continuity of care. Regular system maintenance. Schedule regular system maintenance and software updates to identify and fix issues before they lead to downtime. Proactive maintenance is key to preventing disruptions and ensuring that the system operates optimally. Technical support. Lack of technical support. Inadequate or slow technical support can create frustration for providers and staff, particularly when urgent issues arise. This can cause delays in care delivery and negatively impact provider satisfaction with the EHR system. Best practices. 24/7 support access. Ensure that reliable, round-the-clock technical support is available. This can be through an in-house IT department or by partnering with the EHR vendor for 24/7 assistance. Ongoing training. Train healthcare providers and staff to troubleshoot common technical issues independently. This can minimize downtime and ensure smooth day-to-day operations. Best practices for EHR implementation, training, and continuous improvement. Implementation planning, comprehensive planning. Develop a clear, well-documented implementation plan that includes timelines, goals, and milestones. This plan should address the transition from paper-based records to EHRs, as well as the integration with other systems like laboratory, pharmacy, and imaging. Stakeholder involvement. Involve all stakeholders, including healthcare providers, IT teams, administrative staff, and patients, in the planning and decision-making process. This helps ensure that the system is tailored to the needs of the entire organization. Best practices. Set realistic expectations. Communicate realistic expectations about the time and effort required for the implementation process. Make sure all stakeholders understand that it may take time to see the full benefits of the system. Phased rollout. Implement the EHR system in stages, focusing on specific departments or processes initially. This helps to manage potential disruptions and allows for more effective training and troubleshooting before the system is fully integrated. Training and support. Comprehensive training program. Provide in-depth training for all users, including clinicians, administrative staff, and IT personnel. Training should cover basic EHR functionalities, advanced features, and troubleshooting. Simulation training. Use simulations to allow staff to practice using the EHR system in a controlled environment. This helps build confidence and familiarity before using the system with real patient data. Continuous education. Offer ongoing education and training sessions to keep staff updated on system changes, new features, and best practices. This can help address any issues as they arise and ensure that everyone is proficient in using the system. User feedback and continuous improvement. Monitor user satisfaction. Regularly gather feedback from users on their experience with the EHR system. This can be through surveys, interviews, or informal feedback sessions. Understand pain points and areas where improvements are needed. Address issues. Promptly, take action to address any issues or concerns raised by users. This may involve system tweaks, additional training, or changes to workflows. Demonstrating that user feedback is taken seriously helps maintain staff engagement and support for the EHR system. Performance metrics. Use key performance indicators, KPIs, to measure the effectiveness of the EHR system. These could include metrics such as the time spent on documentation, the accuracy of clinical data, patient satisfaction, and the rate of system downtime. Use these metrics to guide continuous improvement efforts. System customization. Tailor to specific needs. Customize the EHR system to the needs of the practice, considering factors such as specialty, patient demographics, and workflow requirements. This ensures that the system is efficient, user-friendly, and tailored to support clinical and administrative tasks effectively. Regular updates and upgrades. Stay current with software updates and enhancements from the EHR vendor. Regular updates ensure that the system remains secure, functional, and in line with industry standards.